Okay, I think we'll go ahead and get started. We want to welcome everyone here tonight. It is Thursday, May 5th, 2020. This is our study session. It is being held on the Legacy campus in the boardroom, and we will go ahead and begin with roll call.
Larry Jepson, board member.
Randall Bagley, board member.
Steve Norton, superintendent.
Kathy Christiansen, board member.
Jeff Nielsen, board member.
And Dale Hanson, business administrator.
And we have three of our board members who are absent tonight, Terry Rhodes, Chris Corcoran, and Roger Pulsifer. We'll begin with our pledge and mission statement, and that's going to be led by Jeff.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And our mission is to educate students for success in a changing world.
Thank you. Okay, so we are going to begin with our Mountain Crest recognition of the wrestling championship folks.
Terry, you going to start this off?
Okay, thanks. Well, board members, we just want to thank you for this opportunity to be recognized and let you know how proud of our boys and our coach we are. These boys worked hard, and let me tell you some accomplishments at state wrestling. We ended up with a score that beat the highest score that Mountain Crest has ever had in wrestling, and Mountain Crest has been a good competitor in wrestling, and so really proud about that. And I think it's the second highest score in the state for wrestling. So proud of that. And while we were at the wrestling competition, we also had the opportunity to see our second-year coach recognized as the 4A Coach of the Year, Jay Tubby.
Nice.
So I'm just really proud of their accomplishments.
Yeah, thanks for having us. We like this kind of stuff for our kids. I hope they like it too. I don't have a whole lot to say. I'm not real charismatic or good on the mic, so. But a lot of our kids aren't here because they're at practice. So that's kind of cool. So I was excited about that. There's a club down in Centerville that like 10 of our kids are at tonight. So, and they're kind of getting ready for a tournament this weekend. So it never stops. We're excited about that, and we got a great community and administration and people that help us, and we love Mountain Crest, and I love Mountain Crest and the kids and everybody that has to do with it. So we're grateful to have you guys here.
Let's have either you introduce or have the kids introduce themselves.
This is Sam Peel. He wrestled 220 for us. Walker Hutchinson wrestled 182. And Wyatt Cullum wrestled 126 for us. All of them qualified for state and helped us a lot this year. They're all coming back next year. That was one cool thing about our team is we had 14 state placers and 4 champions. And we have 2 champions and 10 placers coming back next year. Wow. So out of the 28 kids that went to divisionals, 21 of them are coming back next year. So we had 7 seniors go to divisionals and like 5 of them go to state. So we have a lot of kids coming back, and so we're excited for the future. Hopefully we can.
Dynasty, right?
I hope so, yeah. We hope to do this every year, so we'll see if we can keep that rolling. So we enjoy it.
We'd like to get a picture,
Okay.
but who's here to take the pictures? Oh, okay, all right. So if you guys can kind of bunch together.
Yeah, that's fine.
And do you have any of your family members here? Family members, would you please stand? We want to recognize you because it takes a lot of support for these young men to accomplish. Thank you so
Thank you for
much.
coming. Yep.
We appreciate you being here and keep up the great tradition. Okay, we're going to go ahead and move on and see if we have any public input. Oh, okay, so we don't need to do them right now then, right? He's presenting, they're both presenting. We've got a place on the agenda for them, so then we don't.
So maybe ask if there's anyone who wants to speak specifically on
On
the
the,
student fees.
okay,
If there are, to do the same.
okay. Okay, is there anyone here that would specifically like to make a comment on the fees, the school fees? Okay, Mike, do you want to tell us whatever you want to tell us?
I'll let that just come up quick. The part of the new state law required that prior to this meeting, we had to let the public be aware of when the board was going to consider the school fees. And so we sent an email out to all of our patrons last week with attachment of the proposed fees for this year. And so we really had no idea if people would be here tonight or not. I did receive a few emails from patrons, and nothing that was really negative, but just the fact that thank you for letting us, have more awareness of what the school fees are. But the school fees for the 2021 school year, they're the only changes, there's only one change compared to what the fees were last year, and it's this one right here in the middle school, and it's the one dealing with the computer, the writing, computer lab, the writing lab, and science lab. It was $14, and they wanted to make that comparable to what the high school was. The science, they just needed that extra money to do what they're doing in their science lab. So that is the only change that we're proposing this year to the school fees, is just that one. The second page is dealing with more of the high schools. There's still no changes with that. We're still waiting this year to finish up where we've set the maximum fees in Section F and also in Section G. We set those maximums, and we've been operating under that this year. And we just need to finish a full year to see how that works. The schools are posting those fees on their websites and accounting for what they're charging line by line for what are those fees buying, and I think that's working out pretty well at this point. So depends if the board has any questions, that's what I'll be asking the board to approve in a couple of weeks on school fees.
Does anyone have any questions? Okay, guess not.
All right, thanks.
All right, we'll move down to Greenville Elementary Trust Land Adjustment.
Troy has a literacy night tonight. It started at 5:30 also, so he
Okay.
has to just come and present quick. So if you'll remember, Troy got moved to Greenville Elementary this year. So when he arrived, the trust lands plan had already been written. And what happened was they had written in to purchase some software for math remediation called Reflex Math. And as a district, we actually asked all of the schools not to go with any outside vendors this year because it was our first year with our new adopted Go Math curriculum, and it has an electronic piece that we wanted everybody to try first and give it a fair shake before we started going in different directions. So with that, when he realized that his plan had been written for some different math curriculum, he took a look at it and said, we'd like to keep the math goal. We still want to improve our math scores, but what we'd like to do is have an after-school math tutor program for students. So they want to take the money they would have spent on that curriculum and move it to, along with some supply money and another little bit of money, to help hire some people to help students after school with their math.
Okay. Anybody have questions on that? Okay, thanks.
Yep.
All right. North Cache.
You gave me a paper and it's too small to read, and I can't read that far away either, so I'm in trouble. But I got my notes here. I'm also new to North Cache, and with that we had some transition time there. One of the things that North Cache had written to their plan was to spend about $6,700 towards AmeriCorps Vista Aid. North Cache did not receive an AmeriCorps Vista Aid this year, so we have that money sitting available in our, I can't remember which fund. Anyway, sitting there, but we can't access it. But we do have other individuals that we've hired that are helping students one-on-one for the same purpose, but we just need to transfer that money into the paraprofessional budget so that we can use it there and be able to serve those kids with the people that we already have hired. So.
Okay, anybody have questions? I just have one question, just for information.
Sure.
So how do you get the Vista aids? Do they,
We notify AmeriCorps, and then they reach out to people and see if people are interested.
is that from the university where they come? Or,
Some of them are university students. AmeriCorps in the past that I've worked with has been an individual out of Ogden that has supplied people, has kind of been the coordinator for it. So,
oh, really?
yeah, I'm not sure if that's still the same person.
Okay, thanks. Okay, thank you. Okay, next we will have the update from the Bear River Health Department on the coronavirus. Mr. Berenston?
You're up, buddy.
I don't know if we're really here to update, we're just here to answer questions, but we do have some information to provide.
Come on up and give us anything you've got, buddy.
All right. I understand you're gonna have a presentation on this, and so we don't want
Yeah,
to take away.
yeah, we'll just, yeah, he'll, and then you'll know what we're doing.
I'm Lloyd Berenson. I'm the director of the Bear River Health Department. Dr. Norton caught me the other day. I was down enjoying a basketball playoff game for the girls. Sat by my wife, and he came over and just had a chance to say, hey, where are we at, and so forth on some of these things. And so we thought we'd just provide you with some information on that. Before I even begin, I want to hand you, if I can, this is a letter that we've kind of put out to what we call our partners in health. And the schools are certainly our partners in health. And so I'm going to go ahead and give that to you if I can for just a moment.
We can just pass it.
Oh, sorry.
Yeah, just give it to us and we'll pass it down and you can.
Within this is more just general information, but you get hit up by individuals as to what's really happening and so forth. And so if you want to use this, you can duplicate it, whatever. One of the things you have to realize is with coronavirus, it's a very fluid issue. Things are kind of changing as we understand a little bit each day. And so we'll continue to update our information. We provide a lot of things on our BRHD.org site. One of the nice things that I think that we have is I think it's really our partnerships. We're here to assist in any way we can. We're not going to try and step on anybody's toes. One of the key issues I know that you worry about sometimes as a board might be when do schools close or when should you make that call and so forth. We're actually here to assist you on that. In the state code, in 26A-1-114, it actually addresses how local health departments actually have that authority. I think schools also have a similar authority when they go in their code and it's designated. The only difference that I can see when I read the code is usually you put out a notification of so much time before you actually do a closure. Because of public health reasons, if there's some liability to the public in general, we can speed that up through our authority and we can take that and make that happen fairly quickly. I do want to say, after we've met with Dr. Dunn and Dr. Miner, we have several meetings each week where we're getting updated and so forth. Right now, the likelihood of that happening is fairly low. I'm not saying it wouldn't happen, but the way we see the disease moving, and actually if we can continue to keep it at a fairly slow pace as it moves into the United States, we hope that that won't be the case. Maybe we can make it till summer and school's out. And, I think we actually had something similar like this with H1N1, didn't we? Didn't we try to hope to get to the end and then see what we could do there? A couple of things just to make you also aware of. Even as recently as today, our liaison, the local health officer's liaison with the state school board, we've had a chance to talk with Terry Schumacher. Is it Schumacher? Shoemaker. And he's been very, we've had really amiable discussions as to how we can approach this thing statewide. There's 13 local health departments in the state. There's actually a policy group that's been created. That policy group is comprised of those 13 health officers, the state health director, which is Dr. Miner, the state epidemiologist, which is Dr. Angela Dunn. You may have seen her on some of the news things and so forth, and a few other key state individuals. And that group will then advise the governor's office for policy. The lieutenant governor's been asked to take a little bit of the lead on this. Tomorrow morning we actually have a meeting with him. I'll have a chance to represent the 13 local health departments, but we'll also have our state counterparts there, the state epidemiologist and Dr. Miner there. So the information that we get, like I said, it's fluid. We'll continue to try to make sure that we have whatever we need to for you. We'll try to provide speaking points if you want, and just be there to answer any questions. There's also an 800 number that's been provided for people that have questions that if you ever want to refer them to. I don't know if this thing refers to that, but it's a 1-800 number, 456-77. Oh, is it on the bottom? Okay.
Yeah.
So, all right. My memory doesn't have to work on that one then. So that's something that you can give to people if there's individuals who have questions and so forth. I also want to introduce you to Keith Larson. Keith is the director of our Division of Emergency Response Services, and he also works as an epidemiologist for the Bear River Health Department. And so he's kind of taking the lead at the local level. And I might just get, Keith, do you have anything to add here that you might just say before I relinquish my? Okay. If it's okay, I'll just have him speak for a second.
Fine, thank you, Lloyd.
We've seen, especially with the announcement of the case that's down in the hospital in Salt Lake, we've seen our call volume increase pretty significantly. There's a lot of people worried in the community and a lot of people that have got concerns, legitimately so, because this can be a serious disease, but it's the 20% of people that are really susceptible, the elderly and those with underlying health conditions, that we're really worried about. Right now, I can tell you that in the Cache Valley area, we do not have any cases that we're aware of. They've just expanded the testing ability, so we have the ability to do more tests in conjunction with the medical community. Our medical community is doing very well for those that are ill and are going in and concerned about it. But, of course, we keep giving the message of wash your hands. The other day somebody said to me, that just seems really silly. You've got this terrible disease coming at you and you're talking about washing your hands. And I looked at him and I said, we are dead serious about that. And he said, why? I said, because our job in public health is all about prevention, and anything we can do to keep people from getting sick is us doing our job. And so when we say wash your hands, it's just not some trite thing that we're saying. We're saying interrupt the cycle of infection by washing those hands with a good hand sanitizer or good hot soapy water for 20 seconds. And you're going to stop your ability to get influenza. There's RSV. There's a multitude of other infectious viruses that are going around this time of year. We've had over 30 people since the 1st of January that have been hospitalized with influenza alone. A lot of the kids have been getting the influenza, the B strain, and now we're seeing a comeback of the ever popular H1N1, and that's the one that seems to be hospitalizing a few people. So this prevention message is a lifesaver, and so that prevention message that you give in the schools of teaching the kids to wash their hands and practice good cough hygiene by coughing into an elbow or a tissue is a dead serious, a very serious message that we're incredibly serious about, because it does save lives. So it's not a trite phrase, it's really a true thing. But anyway, we don't have any cases now. Most of the cases that we become aware of in the future as we move forward, we'll make every effort to make sure that that doesn't spread more in the community. by isolation and quarantine methods and other things like that, but it will probably be starting out onesies, twosies with individuals, and then we'll maybe see a little more spread in the community. But anything we can do to help, please give us a holler, and we're happy to answer questions or provide materials and delve into cases and see if we can sort out what's going on in a particular school if we need to too. So thank you very much.
Thank you.
Stay there for a minute.
Stay there for just a second in case we have questions. Anybody have questions?
I just want, so the kits are now available. Are they at doctor's offices, or I'm just
Oh,
thinking
you mean testing?
testing?
Yes.
Yeah.
So we hope it will become more widely available. Right now, the only place that, well, there's two places that can test, the Centers for Disease Control back in Atlanta and the state of Utah down in Salt Lake. And they can run between, the state of Utah down in Salt Lake, they've got about a 24-hour turnaround. They can run between 20 and 40 tests a day, and they're trained to run 7 days a week. Their limiting factor is staff. They're wearing people out trying to keep the machines going. But in conjunction with public health, either state or local, and our local physicians, based on what the cases turn out to be, we can work on ordering those tests. It's not widely available now, but we hope it will become more widely available in the future. There's a pretty strict case definition right now to get tested, and
Travel's part of that?
Travel's part of it, exposure to a known case, symptomology, things like that.
Okay, so I have a couple of questions.
Yes.
If I can remember what they are. What's the procedure for hospital admittance, and do they have a place there? Are they prepared right now in case somebody did come down with it?
Yeah, the hospitals are using, so they have to have a differential diagnosis of everything that's coming at them. And so when you're talking about influenza and coronavirus and all these other things, pneumonias and strep and all the other things that are coming at them, they are under guidance to use the right protective equipment. And when somebody comes in, they can first rule out all these other things that people can possibly get. But if they are asking that question of where have you traveled, have you had association with a known case and things like that. So they're doing their screening, and I think they're doing a pretty good job. And then based on that and based on the physician's best clinical judgment, we go from there depending on what happens. Now that's not a very satisfactory answer because it just depends on how sick an individual is and what their symptoms are and what test results indicate. But we're in contact with the hospitals regularly.
And just to add on to that, one of the things that we're asking people to do, and this is, valley-wide and so forth, is but if you are sick and you have symptoms, before you actually go into, even regardless of the healthcare provider, we would like you to call first. The reason is you identify what's going on, and that way they're more prepared for when you need to come in. Some of those things they can disqualify right over the phone, and they can help you with that. And so we've got quite a bit of education that's gone out to the physician population, and for the most part, I think they're quite well prepared for that too.
Okay.
They're using a lot of telehealth and other non-face-to-face methods where they can screen a lot of things out in a big hurry. And it's just it's the whole prevention idea to prevent infection, because if we take a healthcare provider offline, then that becomes a problematic thing for the community.
Okay, anybody else have any questions? Okay, thank you.
Thank you.
If you have time, you sit and listen to what we're thinking and looking, and
Okay.
Tim will bring us up to speed on that.
All right.
Okay, I appreciate Lloyd and Keith. We have a great relationship with the Bear River Health Department on many, many levels. They've just been great to work with, and we appreciate their expertise, and they are the experts on this. And so when it comes to any response from the district, that will be done in coordination with the Bear River Health Department, the Utah Department of Health, and we even, follow the direction from the CDC as well. I wanted to echo just a couple of things that they said, because we've been promoting the hand washing and staying home when you're ill and covering sneezes and all those types of things. If any of you have ever read the book Atul Gawande put out called Better, he makes a pretty good case in that book that one of the most important ways that we've eradicated disease worldwide is through the simple act of hand washing and teaching those principles. So I just echo what they said about the importance of hygiene in this whole process and taking some measures. Like to also echo just phone calls, just so the board knows the phone calls have ramped up a little bit for our principals and for us as a school district. I've fielded several of those concerned calls from parents, just different types of issues. What is our plan? How will the school district respond? Should they keep their children at home? How are we prepared to help educate their children when they're home? So all kinds of different issues have arisen as parents have had concern, and we've answered those when we can, and when we can't, we refer them to the Bear River Health Department, or we make the phone call to the Bear River Health Department and clarify that. For example, we have a little boy right now in one of our schools that's in Malaysia, and it gets back on the 26th of March, and there's been some concerned parents in that school about when this little boy comes home, and you don't show signs of the disease or the virus for 2 weeks. How do we, protect those other children in the school? So we've worked with the health department on that issue, talking about that. Karen Peterson, who's one of our nurses, is intervened there, and we're taking the latest direction from the health department on how we handle those types of cases. Just to give you an idea of how fast this moves, we had a letter just several days ago from the Utah Health Department giving us a protocol of what we do if children show symptoms in schools, and also have a travel history, that we should, isolate those children, call the number that Lloyd referred to, and then call the health providers, but make people aware that we have an issue that needs to be looked at. And at that time, it was, anyone that had traveled to mainland China, and may still be, but I think within days, it was in 60, there was 60 countries with confirmed cases, including our own. So those, that changes the dynamic a little bit of travel history, and that's how quickly those things move. Let me just make you aware of some of the things that the school district has done. First of all, we sent out a letter with those protocols and with some information on hygiene to all of our parents in the school district. That letter went out, I believe, last Friday. We, in addition to that, developed a website on our webpage because we knew that information was going to change rapidly. So if you go to www.ccsdut.org/coronavirus, parents can go to that site and get information. Here it is right here. Mike's pulled it up. Most of those links, we're trying to be very careful in what we post on there. You get a lot of stuff in the media and in the news that may or may not be correct, as Lloyd's letter said that he brought. There's a lot of misinformation out there. So most of our links tap them back to either the Bear River Health Department, the Utah Health Department, or the CDC. Once in a while down here on the bottom, we get some news articles that are, I think, very informative for folks, and so we'll include those down in another section. But we put this in a letter that went out to parents. The idea is, because this is quick, fast moving, and there's additional information that comes out, we want them to have a place they can come in the school district to get at least the latest information that we have and know about, because there's a lot of places you can go for that. We also have another web page, I don't believe is on your agenda, but it's just same address, except in coronavirus, it says admin coronavirus. And that's one it's not public facing necessarily, but our administrators can get to that page, and it has additional information that will be helpful for our administrators. For example, the CDC has a page out that talks about what schools' response should be if they do not have any confirmed cases of the coronavirus in their area, and then what happens when that progresses to you do have confirmed cases, what should be the response of schools. And so we've got that information up for administrators. For example, I threw up a map last night from Johns Hopkins University that gives probably the best map I've found of where, how many confirmed cases, where are those cases. So our administrators could kind of keep a handle on that if they have students with travel histories that they need to be concerned about that are also showing symptoms. We are putting together a task force. You need to be aware of, we're going to have our first meeting on Monday. The purpose of that, again, we will refer to the experts when we have individuals with cases, but it's just to be a little more proactive and preventative as a school district. That'll have an elementary, secondary principal on that task force, as well as Mike and Gary serving on that. Kurt Jenkins, Karen Peterson from our nurses, Kurt Mitten, who's a member of our custodial staff. The latest recommendation from the state is cleaning surfaces is, regular cleaning schedules is adequate, but I think that ought to be something that we discuss if what measures we would take and at least know what measures our custodians are taking, if any additional, and what they may want to take in regards to cleaning surfaces and doing those types of things. See, I talked about the protocol. I think in general, we just want to have some agility and some preparation with regards to this. My role as public information officer is just try to get the message out there and get the information to people that the experts have out there and what they're telling us. And that's really our role as a school district from that point of view. Let me switch hats. The two other roles I have with curriculum and instruction and in technology. We have thought, a little bit forward, not to expect the worst case scenario, but if we have students who are needing to stay home, who can't be at school, and this should be the case for any illness really, how do they have access to the curriculum? How do they have access to those types of things? And if in the case that Lloyd says is rare that we may have to close the school, how might we continue to educate kids while they're home? So I sent an email to all of the teachers. I think it was also Friday, or maybe I did it Sunday night actually, just indicating that we've got some great tools in the school district. We just adopted a K through 12 math curriculum that both have digital components to them. We just did a 2 through 6 reading curriculum that has a digital component to it. All of our teachers in the school district have access to Canvas, which is our learning management system, which allows them to post materials for their class that students can access remotely if need be. We're spinning up we do these trainings regularly for Canvas, so teachers know how to get that information online. We are going to ramp up one that's next week. We've offered that, so any teachers that feel like they need some tune-up on that. We have those online materials that are available 24/7. Teachers can go and get training on that tool as well. So I recommended to the teachers that they just begin thinking that direction, and it should be a good practice that they do all the time is what do I do when kids are absent from class for short-term or extended period in my school. We do have 11,000 Chromebooks in the school district. We don't normally send those home, but I think we can be flexible in cases and send those devices home. So students who don't have access to technology that need that access can have that. And I have been working with our tech department. How do we filter those devices so we don't send an unfiltered device into a home that then wouldn't be filtered through our school system? Because we feel very good about our filter system for that reason. So, but I think that about covers it. What questions do you have?
Have you seen the report on the news of what Seattle's doing because their schools are closed?
I've read some Seattle reports, but enlighten me on what you're referring to specifically.
I was just watching this today, and I don't think they've closed down all of their schools, but just kind of the areas where they have some issues. But their teachers are actually teaching to students while the students are watching them on their
devices.
Yeah.
Yeah, we do have that capability. We have WebEx, which is a system built into Canvas where our teachers could do that. They could record themselves and put that up there.
It just looked like a good idea. Yeah. I don't know how much of a nightmare it would be, but
there is one district that I know of right now that is doing that, or going to start it, I think the beginning of next week. So we'll have a district out there that...
In our state?
No, in Seattle area. And it certainly will be good to learn from what they're doing. We might not have all the capabilities that they have, because they're probably a wealthier district than we are in money to spend. But it'll be interesting to see, because they went ahead and closed without any confirmed cases in their district, but just out of caution. And so we'll have some reports of school districts that are weeks ahead of us in that.
Right.
And
That's what I was kind of thinking, is if we can use somebody as a model who's done it and knows how to work out the bugs, if we
Right.
have to do something like that.
Yeah. One of the difficulties is that fine balance between how much do you prepare to go that direction for an eventuality which may or may not happen, and take away from, it's an opportunity cost
Yeah.
of what else
I
we're
don't think
losing
they
in the
prepared
meantime.
for it. You know, it just happened fast,
Yeah.
and so they're kind of
So-
figuring it out.
That's where that agility is poor. I think we're prepped to be able to do some of that stuff. It'll just take all hands on deck to kind of pivot that direction if we need to.
Any other questions?
Oh, just thanks for being proactive on it, Tim.
So the last time we had like the big flu scare and everybody got vaccinated in the schools, they put the big the sanitizer things in every classroom. Is that something we want to do or
Yeah, I remember
not?
that, yeah.
yeah,
And the
I
kids-
think we're too late. Right now, that supply of that
Oh, it's gone.
is gone.
Oh, yeah.
It's all back ordered, but I think most teachers have that already in their classrooms.
Well, I saw on Facebook today this really shady character who's selling little bags of Perel for $300. It's not true, but I
And
mean,
washing your hands with
yeah.
soap actually is better. That's a backup, and but we did not anticipate, and right now, it's back ordered all over the internet, so,
Yeah, that was one thing the kids did do. They loved using the hand sanitizer.
yeah.
So, all right, thank you.
All right.
That's great.
Lloyd, Keith, any clarifications on anything I misspoke on, or?
No, we just appreciate being able to work with you, and we hope all the other school districts will be proactive.
Yeah,
Thanks for
thank you,
coming.
thank you so much
Yep.
to all of you for planning ahead.
And there's not anything better than a meeting that you can actually leave and
Okay, our next item is the surplus property at North Cache. And that looks like, that's you again, Mike.
I'm going to step over here by the computer. When we opened the new high schools and we put the 9th grade into the high schools up at North Cache and also at South Cache, that left the seminary buildings right here on the corner vacant. And the church has been trying to sell these seminary buildings for a good 2 years now, maybe longer. And over time, you know, the last 2 years, we've had different people come and just talk to us. You know, what were we going to do with the seminary buildings? Of course, we had to tell them that was church property, and they'd consider other ideas. But before we can really talk to people about maybe some options that we could have as a school district to help with the facility if there's a company that's interested in that building. There's a piece of land right here that North Cache owns right there, and I gave you a handout with that on, that little section right there, and it's less than an acre. But if you've ever been up there on that property, right across here, about right through here, is the goalpost set on the South Cache property, and then that hill just slopes right down.
North Cache.
Yeah, North Cache. The hill just slopes right down. And say, we've had people talk to us about, hey, would you ever be interested in selling that land? Because it would help. They would be interested in maybe that building if there was some other options with that land. So the first thing we need to do before we should really make any commitments or really be talking in much detail with other people who might be interested is to have the school board declare that part right there that I have identified as surplus property. So then that allows us now to start going through a process. And then at that point, we could start going through that process and then bring back to the school board some options on people who may be interested in that property and how that can maybe work for the benefit of not only that person who wants to buy that property, but how it may benefit North Cache. We went up and visited with John Anderson at the school, Scott Rigby and I, because we've had people interested in that say, what if this happened, what if that happened? And I think John's totally on board. If we put that out, if the board would declare that as surplus, and then it gives us the road ahead to where now we can start talking to people about that property for those who have some interest. So any questions from the board at this point?
Where would you move the parking?
There's no parking right there. That's just grass right here.
Oh, it's just the front strip?
Right there.
Okay, I thought you were going further.
And right now, that's a slopey hill.
Yeah,
And
okay.
it's hard for the custodians to even water, to mow it, things like that. That's why we feel like we're comfortable coming to the board saying we're all supportive in the board declaring that surplus. So maybe we could work something else out with somebody who's interested in buying that where it'd be a better benefit to the campus of North Cache.
Who owns the property to the east, or what's that used for? It used to be a football field, right?
That is our
It
property.
still is? Oh.
Yeah, that is still all.
Is that our property, did you say?
Yeah. All of that is our property,
Oh, okay.
okay, right through here. That whole parcel where it's outlined, that's all school district property, okay? But the school really, at this point, wants to keep the part up in here, the flat part, we want to keep that, but this part to the west right there that I've drawn through lines is what we're asking the board to consider to declare as surplus property. And then we'd come back to you with some options on some businesses and people who may be interested in buying that and how that may benefit everyone.
Mike, what's on the bottom side of the property, where your line's coming down there, right at the very bottom, at the parcel line? It looks
Right
like
here?
there's- Yeah, coming down,
Down here,
yeah, over now, yeah, just right in that area, what is that?
that's bleachers.
Bleachers, and then.
There's a
further
little
over, is that
storage,
little-
there's a little storage building right there that we have, and those are bleachers. Now, this property here is owned by someone else,
Okay,
okay?
okay, thank you. So the property line would just go right next to that storage
Yeah,
shed?
yeah. You know, or we'll bring back the proposal to the board so you can see it, but we can't do any of this without the board declaring it surplus.
Then it just goes out to a regular bid process. Nobody, it's not, everybody has a chance to.
Yeah. But there are people out there who would be interested in that, but before we can really talk to them, the board has to give us that
So,
option.
Mike, in your opinion then, based on what I'm hearing, we don't even really want it? Is that the,
It's not benefiting us.
okay, not benefiting the district?
Yes, it is not.
And we're having to water it, mow it, and
Yeah.
keep
Great
it
place
looking.
for soccer balls to roll over.
Roll down the hill.
I get it, okay.
Yep.
Okay,
Any
So
other
what
questions?
we would do is come to the board then in a couple of weeks and ask for your approval to declare that as surplus. And then our next step would now be bringing you back options.
Okay.
Okay.
Questions?
Any questions, Dale? Did you have something?
Yeah, and I'd just say, when we consider what the options might be there, we will need to have the land appraised, so that would be at least a minimum value that we would accept, when we put it up for a public bid. And I know Scott's in the process of doing that, but said it's still going to be at least 5 weeks out or so before he can get someone in there yet. But that would protect the district so that we don't just give the land away for a nickel or something like that. whatever it might be.
Maybe you mentioned this, but what are the dimensions on that piece of ground?
I did it quickly where on GIS, you can go in and drop it through, and it's around 0.7, it's less than an acre, I believe. Okay? But we'll bring you all that information. You know, what we don't want to do is harm North Cache and what they want on that field on the top. So that's what we would be working with to make sure that North Cache has what they want, and then we'd go from there.
Is there a fence that runs along where the highway is at all?
There's a fence right along the highway that
Okay.
stops the soccer balls.
That's what I was wondering
We'll just
about.
put it up higher, and
Yeah,
you don't have to go down the hill.
Yeah, okay.
yeah.
All right.
Any other questions on it? Okay,
Thank you.
so we'll ask for that in a couple weeks.
Okay. All right. Okay. On the board president report, just a couple of things. You hopefully got your schedule for the regional meeting. Did everybody get that? Okay, so ours will be March 26th at 6 p.m. at the Beehive Grill. So if you haven't calendared that, go ahead and put that down. Also, I received this information about a job. I don't know if the rest of you got it or not. It's, what's his name, Shoemaker?
Terry Shoemaker's
Terry, did
position.
everybody get that? Okay, so that's available if anybody wants to apply. And then the last thing that I wanted to just mention is, as you're going to school community councils over the next couple of months, they will be putting their plans together. And last year, when I was reading the ones that I was assigned to read, some of them were just great, and you could do it in about 5 minutes, and some of them, it took a lot longer to figure them out. But I'm going to give you a copy of this, especially if you have a new principal at any of the schools that you go to, because this one I was able to do in 5 minutes. So I'll hand it to you, and then I'll explain. So one of the things that we have to watch for is that when they list their expenditures down in this little diagram below, they also have to put those expenditures up in the action plans. And Mike has told us that a few times, that needs to be done. But I really liked how this school did it, because you can see what I have in yellow matches right with what's down in the expenditures. So it was really easy for me just to put a little check mark. Yep, they've got it up there. Oh, yep, they've got the 2,000. Yep, they've got the 10,000. Yep, they've got the 2,146. So maybe for the new principals, you could give them this so that they could see and explain to them. And if you have principals who've made it a little more complicated and harder to follow, you just might show them this, that this is a really easy way to do it. It's going to save them tons of time. It's going to save us tons of time. It's going to save Ann tons of time, and whoever else looks at it. Do you have any questions on this at all?
Looks good.
Yeah, I thought the person did a really great job on it. Okay, that's all I have for you.
And I was originally scheduled to give you an update on the virus, and it's already been covered, so very, very nicely done by Tim, and we spent a lot of time talking and trying to anticipate. But if they ever get to the point where we close schools, it is a major undertaking, and it will be for every family that has kids in our school. And so we'll just wait and see how it comes out. But we will take direction from the state health people when that time comes.
Okay. Are any of you scheduled to go to the legislative meeting Saturday morning? So it's got to be one of the other people here. I did take our district, State of the District booklet and gave to 4 of them who were there. And I'll go Saturday and give the other 2 out. And they were very receptive. And appreciated having a copy of it to look at. So that was a good idea,
It's a nice book. yeah.
to put it in a booklet form.
Yeah.
Okay, does anyone have anything?
Any new developments with the legislature this week?
Well, yeah, there's a couple of major ones, but, and there is a plan that's now in bill form. He's got it. But until the legislative committee is going to meet tomorrow, and they'll take a position on it, but it, in essence, would add 3 letters to the constitutional mandate that we have, that the money be spent on public education. It would add children and disabled.
Okay.
And with that, there's a whole gamut of things, but I don't know if it's gonna make it through that committee tomorrow. So there's no reason talking about it to you tonight till we really see
Where it goes.
if that legislative committee is gonna support it. If they don't support it, and your school board president and the superintendent's association's president, and there's one other person, probably the governor's gal, have met with legislative leaders for the last 2 weeks, and Terry Shoemaker was there, and he seems to think this is the very best that we could get. And if you have been reading on Utah policy, they've been kind of rattling, or not rattling chains, but they've been pumping their fists and made statements like, you might have a guarantee revenue, but you don't have guaranteed funding. And we could take $2 billion away and still, and that's taking the property tax that goes into schools and move it over. And so they've been throwing out all kinds of scenarios as to either play the game with us or we're going to go this other direction. So I think it's a pretty good bill, and I think it does a lot to help the districts that are low in market value. So, but I'll see if I get through tomorrow, and then maybe I'll throw out a little synopsis of what happened.
Okay.
Yeah, they're pretty dead set. The only thing that I would like to see, I'd like to see them be able to come out and say, right now it's, the education community has all the money and we don't have any. And I just wish they would come out and say, the education community does not have enough money to do what we need to do for education, but they are willing to share what is there with children and disabled programs, and that we as a state have money going out of our account to pave roads to the tune of about 500, 600 million. So that's what's caused the problem on that side of the budget. It's not that the revenues dropped. They've just dedicated that they're going to move that much money over to transportation. And ever since, Lau voted against that when they first proposed it, earmarking money. But it's been there for years, and that's what's made it so tight on that side. And I just wish they would bring that out to the public, because they never have. It's making it look like we as the education community are not willing to help out
We're
the
the bad
rest of
guys.
the state. When in reality, I could throw this district into a tailspin too. All we have to do is say, we're going to build a school next year with general funds that are used to pay salaries and run the district. We'd immediately go into the same type of crisis. And they've created that crisis, but they never will bring it out and talk about it. That's all I'd like to see them say is, we understand that we were, and I'm not saying that it isn't a good deal to keep our transportation system highways up, but I am a firm believer that it should be paid for by people who use the roads.
Well, yeah, user's tax, right?
Yeah,
I mean,
user's tax.
That's fair.
We're the only state in the union that uses general revenue fund to build roads. So when they say, they keep pounding the nail that we're the only state that puts all of it, the income tax into funding schools. Well, there are states, numerous states, that put all their property tax, and that's what funds the schools. This state made an effort in 1933 to say, we'll start a new tax for education, and it's right now pretty healthy. But we are players too. We understand there's needs in the state, but to say that we aren't players in this, I think is unfair. So,
All right, does anyone have anything else?
she might have wanted to say something. I
Oh.
don't.
Do you have something for us? Oh,
Oh,
welcome.
And we just have a son who's autistic, and before we moved here, I talked to Mr. Allred, and he said he would, do I have a self-contained classroom? Sorry.
Do you want to come up and use the microphones? We're recording this, so it's nice to have your input. Oh, yeah, we do.
And I was just at work getting ready to leave, and I saw you guys had a study session, and it's kind of on the way home, so I thought I would just.
Yeah, just come right up here.
Basically, Mr. Allred is great.
Wait till you get to the microphone. There you go.
Okay. Mr. Allred has been very receptive to us. He called me Friday, and he, based on our son's situation at Sunrise, he is very open to the idea of starting a self-contained classroom. So after working, my husband was active duty military for 32 and a half years, so we've been in multiple states and multiple districts and multiple, thank you, sir. So our son has not been in a general ed classroom since he was in first grade.
How old is he?
He's 10, in fifth grade. So he's now in a classroom of 36 kids, which I also researched and saw you guys just passed on the February 20th board meeting, that the max class size will now be 28 for K through, well, no, 3rd through 8, and I think K through 2nd was 23. And then 9th through 12 will be.
They won't all be 28, but kind of an average.
Okay,
An
sorry.
average.
And I remember when I worked at the school district in Texas, I was there for 5.5 years in the deputy superintendent's office, and we did a lot of policy implementation and review, and I kind of was thinking back there how much paperwork you would get, Ms. Christiansen, as the president, above and beyond even what the board gets from the packets and things we had to do to prepare for board meetings. So, and I have no idea what a study session was, so I just thought I'd come by. As I said, Mr. Allred is very receptive. He called me Friday, and we're actually having my son's IEP team meeting tomorrow, and I'm hoping that he will continue to go down the path he shared with me on Friday of creating and designing a self-contained classroom for autistic children. Because our son's high functioning, he's brilliant. He also has, other diagnoses as well. We've reached out to the Utah Parent Center to kind of help figure out what we need to do law-wise here since we are fairly new here. But he liked the idea of that because our son is not thriving at all. He's been inpatient twice in the last 6 weeks, directly related to things happening in the school, which I know none of you want. It's not concurrent with the mission statement, nor the vision statement. Sorry. I do know there was a grant that happened 3 years ago that Cache County neglected to participate in. That was the STAR Autism program. For whatever reason, I wasn't here. It's ending at the end of this academic year. It was provided by the Wood Foundation in conjunction with Utah Valley University. And then in my research prepping for the IEP meeting, I've even found out they don't have any more training right now. They're in talking with the foundation to see if that would be funded still or not, by outside sources. So anyway, I hope I don't frustrate Mr. Allred by stopping by here, but.
Oh, no, not at all.
He's been fabulous. The campus has good hearts, but honestly, from a parent perspective, and then after working in a school district, I think there just needs to be a lot of training for children with autism because I don't know how much you know about it, but everyone's unique. Some are great in conforming to what is needed and required, and, can just follow their structured day and go forward. Others are not. But I know, like, our son is very overstimulated in a class of 36 kids when he's used to being in a class of 8 to 10. He has a single aide. He doesn't like being singled out, yet everything he does is singled out when he actually is allowed in the general ed class, because he's not even allowed in the classroom right now. So, anyway, I just kind of wanted to see how quickly, and just kind of have a little more research. And I don't know the procedures here, and that's kind of why I was just kind of sitting in the back, kind of listening to see, how quickly something could be implemented. And I know Mr. Allred said he would have to design it, but I like to do research and get all my facts in a row and know what it is to help, because our son's not the only one who needs help. I know there's other children in the district, north, south, all the way around in the whole donut, surrounding Logan and Cache Valley, that could benefit from it. And that the school district we came from had self-contained classrooms, and they only had 11,000 when we got there. No, it was 12,000. And I know you guys are up to 18, and I was shocked to see that. The school district I worked was 15, and then it went up to 17 in the time I was there. And it just kind of surprised me, because I thought you were a small school district, and when I saw the numbers, that's not as, that's a lot of kids.
We have a lot of children in Utah.
Right, right. So, and we've been in San Diego. That's where we first went to school. Then we went to Fort Worth, Texas. That's where he went to school next, and now we're here. So he's been in self-contained classrooms, which the smaller class size, 10 to 15 or less, since he was in first grade.
Did you say that at Sunrise he has an aide with him?
He has a one-to-one aide.
All
but then
day?
he also, all day.
All day?
But the aide changes. It's not one aide. And I think because it is hard to get aides, and I understand it's really hard to get aides, the training of the aides, like in behavioral techniques and de-escalation techniques and things like that, versus just having full-on escalations, trying to stop before it hits peak crisis and then goes back down.
So is there anyone from the district who's here that would like to comment, or?
Well, I suggest that Gary Thomas sitting right there is your director of elementary ed.
Hello.
So he's probably who you need to just share some things, because there's a lot we need to know. We have self-contained classrooms.
But not for high academics.
Yeah. So we need to know what kind of,
Right.
what help you've received, what you expect, and of course, Joel already is the person
Right.
over that. But if you'll work with Gary and we'll try and see if we can't absolutely meet your needs.
I appreciate that.
We know that it's not healthy for any kid to be in 36 kids.
No.
That's
Let alone if they had struggles.
Yeah, there's a price that we just haven't paid in this state to have class sizes where they need to be. But when you have handicap conditions on top of that, some kids will never function with that many kids around. And so we'll work with you, and Joel is a wonderful individual, but he needs to be working with Gary and the principal, and we'll sit down with you and see if we can't make something work.
Well, and one of our friends back in Texas, she actually was assistant director of special ed in that district, and then she got recruited out by, it's a company out of Portland, but they go internationally, and it's called Star Autism, and that's who did the grant here in Utah, through Utah Valley, and they actually have curriculums that districts can purchase, and ABA, which is Applied Behavior Analysis, is integrated in it. I know when we were moving, we were looking at Idaho Falls here, or Davis County, near Hill Air Force Base, and Bonneville School District up in Idaho Falls, and Davis School District both have ABA integrated classrooms. Davis, I believe, is the one who had the social and emotional classroom for children who are high-functioning autistic. Just need that smaller setting, a little more structure, a little more engagement, a little more ability to move around, a little more, versus just sitting and doing and just having those 2 recesses each day. So, that's something I know they can turn around really fast. Like Dallas School District called, and the next week they were there training their people. And I do know Utah has consultants because my friend told me so. And then I actually called the company today and they confirmed that they do have consultants.
So would you give your name and phone number to Gary?
Sure.
Yeah.
Okay, and I just wanted to kind of figure out, kind of see timeline. Could it be before the end of the year, because there's only 3 months left next year? Could it be, and I'm pretty sure Mr. Allred was spot on in saying, you know, it's gonna take time, I have to design it, I don't know what will happen. And tomorrow we go back to the drawing board at 11 at sunrise, so
Okay.
fingers crossed.
Thank you very much. We
Sorry,
appreciate it.
Thank you for listening.
No,
Sorry,
don't ever
I'll-
feel sorry. We'd like to hear things that we can improve on and see if we can find ways to do that. But we do have a state with lots of children. And so even though it may say there's going to be 23 children in a class, that's the average.
Right.
So hardly ever do the normal classroom
Right.
teachers have the average.
Right, and I remember the first week of in school in Texas, we would actually have our evening meetings for the cabinet of the district, and we would crunch numbers and move classrooms and hire new teachers, because they had a strict, you had to do 22-to-1 K through 4, and if you went above it, you had to get special permission from the state board
Yeah,
of
that's not going to
education.
happen here, I don't think.
Sorry.
Wish it would.
Wish it was that way.
Yeah. All right, thank you so much. We appreciate you
Thank
coming.
you, ma'am and gentlemen, I appreciate it.
All right. Thanks to our district people and everybody on the board for being here. And anyone have anything more? Okay, this meeting is adjourned.
Thank you.